Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them spryly. This episode unpacks Aedes-borne Flaviviruses, mostly found in the tropics. Try these cues before we start. Which Flavivirus is linked to congenital joint contractures? Which clinical feature gave yellow fever its name? Which Flavivirus greatly reduces platelet levels? Let's launch. Flaviviruses are enveloped, icosahedral, positive-sense single-stranded RNA viruses. Because their RNA is already in a form that ribosomes can read, they can start making proteins right after entering the cell, unlike negative-sense RNA viruses, which need to make a copy first. Unlike DNA viruses, they don't enter the nucleus to replicate. Their lipid envelope makes them less stable than non-enveloped viruses because detergents and heat easily destroy it. First is the dengue virus. It spreads mainly by Aedes aegypti or Aedes albopictus mosquito bites and, in rare cases, transfusion of infected blood. Dengue is endemic in tropical and subtropical regions. Dengue mostly affects residents and travelers in tropical areas, especially kids. Incubation lasts 4 to 10 days. The illness has 3 stages. The febrile stage features a high fever and rash lasting 2 to 7 days. The critical stage during days 3 to 7 may cause blood vessel leaks, bleeding, and low blood pressure, especially in reinfected people. Recovery follows as fluids return to the bloodstream. A first dengue infection is usually mild. Reinfection can cause severe illness because antibodies assist virus entry and exaggerate immune responses, a phenomenon called antibody-dependent enhancement. The NS1 protein damages blood vessels, causing blood plasma to leak, leading to hypotension and bleeding. Falling platelet counts, due to low production and immune-mediated loss, contribute to hemorrhage. Symptoms include nosebleeds, gum bleeding, easy bruising, and red skin spots, especially after minor trauma like brushing teeth or bumping into objects. Severe infection can cause dengue hemorrhagic fever, shock, multi-organ failure, or death. Next is Zika. The virus is mainly transmitted by Aedes aegypti or A. albopictus bites, but can also spread through sexual contact, mother-to-fetus transfer, or blood transfusion. Zika is most dangerous for pregnant women and people in endemic areas. Zika is common in tropical regions where Aedes thrives. Virulence comes from crossing the placenta to infect fetal neural tissue and evading the immune system. Incubation lasts 3 to 14 days. Infection is often mild, lasting 2 to 7 days. Common symptoms include low-grade fever, rash, conjunctivitis, and joint pain. While most cases resolve on their own, infection during pregnancy can cause congenital Zika syndrome, presenting with microcephaly and brain malformations. Adults may develop Guillain-Barre syndrome, marked by weakness starting in the legs and moving upward. Involvement of breathing muscles can be fatal. Next is yellow fever. The virus is transmitted by Aedes aegypti in cities and Haemogogus or Sebaces in forests. Yellow fever is common in parts of tropical Africa and South America. Unvaccinated people in endemic zones are at greatest risk. Incubation lasts 3 to 6 days. Illness begins with sudden fever, followed by a brief remission. Common symptoms include fever, jaundice, muscle aches, headache, nausea, and vomiting. Severe yellow fever can cause deadly liver failure, bleeding, and shock. Yellow fever's name comes from jaundice caused by viral and immune liver damage. All 3 viruses hit hardest in low-resource settings where clinical judgment often determines treatment. Reverse transcription polymerase chain reaction or serology may be used to identify them if available. For dengue, NS1 antigen testing provides early diagnosis. Treatment for all 3 is mainly supportive, including rest, hydration, and management of complications like dengue's low platelets, Zika's joint pain, and yellow fever's liver damage. Patients with dengue must avoid NSAIDs and minor trauma to prevent bleeding. Prevention centers on mosquito control and repellents. Dengvaxia is available but reserved for previously infected people for safety reasons. Safe sex plus extra caution are vital during Zika outbreaks, especially for pregnant women. The yellow fever vaccine offers strong protection. Let's review. Which Flavivirus is linked to congenital joint contractures? Answer: Zika virus. Which clinical feature gave yellow fever its name? Answer: Jaundice. Which Flavivirus greatly reduces platelet levels? Answer: Dengue virus. All correct. Epic. Learn something today? Click like, share, and subscribe. Scan the summary table in the description. Thanks for watching.